Today we're doing a PA axial projection, also known as the Haas Method. This is usually done for patients that are obese, hypertonic, or have trouble being in the erect position. So this is actually done prone. Okay, the first thing you do is you actually place the shield on there if you're going to position the patient. Okay, so for the PA axial projection, also known as the Haas Method, it's usually devised to be able to see the foramen magnum on patients that otherwise can't have it done by the towne projection. So the first thing you do is you get in a 10 by 12 cassette. You go ahead and put your marker in it, just like she has already done. Next thing you do is that you adjust the patient in the prone or a seated upright position. We're doing it prone. And you center the mid-sagittal plane of the body to the midline of the grid. So she's going to do that.
Yeah.
Okay, seems like she's already done that as well. You're just going to flex the patient's elbows and place the arms in a comfortable position for the patient and adjust the shoulders to lie in the same horizontal plane. Okay, and as for the position of part, you need to rest the patient's forehead and nose on the table with the mid-sagittal plane perpendicular to the midline of the grid, and it seems like she's done a good job. Okay. The next step for this is to adjust the flexion of the neck so that the OML is perpendicular to the IR. She's also done that as well. Please. Okay. The next step is to just make sure that the patient isn't moving because that could severely affect the radiograph. And remember that for a localized image of the stellar region and or petrous pyramids, adjust the position of the IR so that the midpoint will coincide with the central ray. Shift the IR cephalad approximately 3 inches to include the vertex of the skull. An 8 by 10 inch IR is recommended. Also remember that the tech is going to tell the patient to suspend her respiration when taking the radiograph. And it seems like she's already done that. All you're going to do is angle the central ray 25 degrees cephalad. And it seems like she's done that. There it is, 25 degrees. Okay. And as for structure shown, it shows the occipital region of the cranium and shows a symmetric image of the petrous pyramids and dorsum stellae within the posterior clinoid process within the foramen magnum. For the evaluation criteria, the following should be clearly demonstrated. There should be an equal distance from the lateral border of the skull to a lateral margin of the foramen magnum on both sides, indicating no rotation. You should be able to see the entire cranium on the radiograph as well. Okay, the last thing you should be able to see is a symmetric petrous pyramid, because if it's not symmetric, then you probably didn't get the entire skull anyhow. Okay, and this is the PA axial projection, also known as the Haas Method. So remember, 25 degrees cephalad, patient is prone, with elbows in a comfortable position, and right in the mid-sagittal plane. As you can see here. Okay, and remember to have suspended respiration when taking this radiograph to avoid any motion.